Hey, Drasco here from Quick Body Weight Loss in Mississauga. In today's Weight Loss Minute, we're taking a look at how to stop knee pain. Now, this is something that we deal with on a day-to-day basis with all of our clients because a lot of them come in having some sort of joint pain. Knee pain tends to be one of the more common ones. So we approach this problem many different ways, depending on the client, because a lot of our programs are personalized because a lot of knee pain tends to be personalized. So it's not necessarily the same for everybody else, but there are certain commonalities. And in this video, we're going to take a look at what are the commonalities and subsequently what you can do to help that situation. So the first things first is knee pain isn't usually joint pain, meaning like it's your actual knee joint that hurts, but it's usually the site of the hurt as a result of something else. So what am I talking about? So oftentimes through sitting or inactivity or sometimes excessive activity, the muscles around your leg get tight, okay? And then when they get tight, they actually pull back on a lot of the ligaments and tendons in your knee. So if you imagine like if your knee joint is here and you got these like kind of ligaments and things that are holding it in place, if the muscle up here is tight, it's kind of pulling in. So you can think of it like crunching in a towel, like you squish it here, it pulls this back. So as you pull this back, what ends up happening is now these are overstressed because something is tight up here. And then this ends up being the victim of the culprit, which is up here. And then that's the part that hurts. It's while you feel knee pain, really the issue is somewhere up or potentially down the chain of your leg. So until you release those bits, it's very hard to let the knee pain go. So how can you do this on your own? Well, we have various different modalities in our programs where we use simple things like rollers and tennis balls to help you relieve this knee pain. If you don't have access to these or don't know what to do, just getting a simple massage or seeing a physio will certainly help relieve some of that and definitely get it assessed if you are going to get physio. But that's kind of one area that we deal with. The second part is a lot of knee pain is actually due to inflammation than it is anything, again, related to the joint itself. And this can be a whole host of different reasons. It can be from the nutrition that you take in on a day-to-day basis. Like the more processed foods you eat, the more your body will be inflamed, and that usually will attack your joints. And if you are diagnosed with something like osteoarthritis or any kind of arthritis, then you know for sure that inflammation is going to be a factor. So the way you treat that is the cleaner that you eat long-term, the lower those symptoms are going to be. As far as supplementation, things like that, you can certainly start adding in more omega-3s. That will help decrease that inflammation over time. And then the last part is basically weak muscles or imbalances. This is kind of the third factor when it comes to knee pain. So if you've had an injury before, or again, lots of sitting, or like one side of your body hurts more than the other, you're going to eventually have certain imbalances that are going to be putting more pressure on one joint than the other. And you can relieve the pain in that joint, like let's just say it's your knee, as much as you want until that imbalance is taken care of, until you get stronger overall. You're never really going to solve the full issue. You're just going to be treating the symptoms. So again, if you don't know how to do this on your own, definitely seek out some sort of professional. If you want us to help you with that and combine it with the weight loss, by all means, you can reach out. But that's just a different way of thinking about knee pain, that it's not necessarily about the joint. It's usually a bigger problem. And then the joint is just the victim of whatever the culprit is. So that's it for today for the Weight Loss Minute. And if you do have any questions, feel free to reach out to us. Otherwise, we will be back here again with another video next week. Thanks. Bye-bye.